Hi, I'm Ellie and I'm a pharmacist at Boots. Looking after yourself during warmer weather doesn't stop at SPF and sunglasses. There's also the chance of developing heat exhaustion or heat stroke, also known as sunstroke. Keep on watching to learn more about these heat-related conditions, including the signs and how to treat, plus our top tips to keep cool. Heat stroke, also known as sunstroke, is a medical emergency that may develop if heat exhaustion is left untreated. But what is heat exhaustion? It's a condition that can happen if someone is exposed to very high temperatures. While anyone can develop it, heat exhaustion is most common in children and older people, plus people with certain health conditions like heart disease or diabetes. Like we mentioned earlier, heat stroke may develop if heat exhaustion isn't treated. Heat exhaustion develops if you're exposed to very high temperatures for a prolonged period of time with not enough fluid intake and your body overheats. Other factors that may increase someone's chance of heat exhaustion include not drinking enough water, wearing dark, tight clothes, exercising in the heat, being outside in the sun between 11 and 3, and for adults, drinking alcohol. Heat exhaustion can be treated at home, but if it doesn't get treated, it can develop into heat stroke, which is a medical emergency. Symptoms of heat exhaustion include tiredness and dizziness, headache, feeling sick or being sick, excessive sweating and skin becoming pale and clammy or developing a heat rash, cramps in the arms, legs and stomach, fast breathing or heartbeat, a high temperature, and being very thirsty. The symptoms are the same for adults as they are for children. However, you might find that children are also more irritable. Signs of heat stroke are still feeling unwell after 30 minutes resting in a cool place and drinking fluids, having a very high temperature, having hot skin that isn't sweating, a fast heartbeat, shortness of breath, confusion and lack of coordination, seizures, and losing consciousness. Heat exhaustion can be treated at home by resting in a cool place, removing all unnecessary clothing like jackets or socks, drinking cool water or a sports or rehydration drink, and cooling the skin. You can do this by spraying or applying cool water with a sponge and then fanning. You could also use an ice pack. Continue to do this until they're no longer hot to touch or their temperature returns to normal. Heat stroke, however, is a medical emergency. If someone you're with has heat stroke, you need to call 999 immediately. If they lose consciousness, put them in the recovery position as you wait for help. There are some ways you can help to prevent heat exhaustion, such as drinking cold drinks, especially if you're active, wearing light-coloured, loose clothing, avoiding the sun when it's at its strongest, avoiding alcohol, avoiding strenuous exercise, and if you're inside on a very hot day, close curtains and turn off any electrical equipment or lights that get hot. And you may also want to use an electric fan. Remember, if you or someone else begins to develop symptoms of heat stroke, you must call 999 immediately. And if you're looking for more health-related videos, make sure to like and subscribe to the Boots YouTube channel and check out our dedicated health hub for further advice and support.